Hello, my name is Katie Louvier, and today I'll be talking about end of life issues and how that relates to the field of nursing. So, end of life issues really encompass the full practical, legal, ethical, medical, and emotional factors that come into play whenever we're dealing with a patient who has got a terminal diagnosis or they may be in those end of life stages. Some examples of this, some examples of issues that us nurses can face is just communicating about end of life choices, whether that's with the patient or the patient's family, pain management, ethical dilemmas, and we're about to talk about that in the next slide. Coping with loss, whether that's how we're helping the patient's families grieve or how we're dealing with that loss ourselves, because it will take a toll on us as nurses. The evidence based article I found was ethical considerations at the end of life care. This article talked about the struggles that physicians and just really anyone in the medical field will face when dealing with patients who are at the end of their lives. It talked about how the goal of end of life care is to prevent and relieve suffering as much as possible while also still respecting the wishes of our patients. Um, the four ethical values it just suggested that we implement is autonomy. So this is just giving the patient a chance to choose what they want for themselves. So as nurses and healthcare professionals, we need to advocate the use of advanced directives so we're doing what the patient wants and so we know what they want. It also talked about implementing beneficence, which is basically just doing good for the patient. So, as nurses, we can also advocate the approach that provides the best care available for this patient that coincides with their circumstances. We also need to implement justice. This really just ties into the fact that every patient's going to get treated fairly. Every patient should like get the resources that they need. So it's important that we educate ourselves and the families on improved treatment outcomes and what might be best for the patient. And then non maleficence is just the will to do no harm. So for this, we can advocate prevention of unnecessary treatments or interventions. A lot of times, families will want to do everything to keep the patient alive, but sometimes that can do more harm than good. So it's important that we advocate for our patient and really just say, that's enough. So the BSN essential I chose was person centered care. This emphasizes the importance of respecting our patients' preferences and their needs and values. Um, person centered care really promotes autonomy, management of pain, holistic support, and involvement of family and loved ones. So it's really just important that we include the patient in including their honors and wishes, really just in what they want all around, giving them that patient centered care.